So, first and foremost, I really want to thank the patients that I work with. Truly, I really mean it from the bottom of my heart, because you cannot do anything without willing people trying new things, right? There's several of you here in the audience that I've observed that are patients that have helped me develop this protocol, because science has to advance, okay? Technology has to advance, thinking has to advance, and intelligence has to advance, and we can't do the same things we did 10 years ago. It's just not going to work in the future. So we got to reinvent ourselves, reinvent new things all the time, which means that you got to be thinking all the time. Otherwise, you're going to be left behind, because technology is moving so rapidly, right? So I want to thank specifically patients here who have given me permission to do a few things. And I'm going to show this because they've given me permission to do so. And I want you guys to watch this person on the TV, okay? I want you to see this person. She's in the audience. And I just want to take a minute for you guys to just observe her. So obviously, this is before. This is after. So what do you guys see there? What kind of changes do you guys see there?
Wow.
Can everybody see this?
No.
Well, it doesn't really do it.
Take a look, please do.
If you guys want to take a look, because you guys need to really see this. All right? I'm going to show you something else here. Take a look at that. Okay? I really want you guys to see this. If you cannot see it, please get up and watch it. And I really want to thank you. Go ahead. I'll go over it. So I really want to thank her, because it takes a lot of courage for her to give me permission to allow me to share this with everybody. One of the things in aesthetic surgery, right, is that people want to be secretive because they don't want other people to know. But it takes courage to be out there to kind of be a pioneer, not only as a doctor, as a surgeon, but also as a patient. I want to thank her because she's made, actually I've learned a tremendous amount from her, because she's one of the best patients I have. A lot of, everybody is, but she said, Dr. K, I trust you, do whatever you need to do to make me look good. Wow. That is the best type of patient that I can have, right? Because I don't have shackles, I don't have limitations, I have the luxury of time, because one of the things, if I've learned something in 13 years of practice so far, I worked at Vanderbilt University, I trained at the Cleveland Clinic in Ohio, I taught, I did research, I killed a lot of rats. One thing I learned, right, one thing I really learned is that surgery is a process. There are no magic bullets, there's no quick solutions, surgery is a process. Healthcare is a process. So you need to be patient, you need to think through problems and treat them. So in this particular person's case, there's a lot of things that are different, right? The number one thing that I want you guys to notice is the texture of the skin, right? So as a surgeon, it's humbling, There's limitations, there's just always limitations. What can I do? What can I do? There's nothing I can do surgically to improve skin, right? I could pull it, tighten it, I could do all kinds of stuff, but I just cannot change the native architecture of skin. And there's been tons of tools since the 1980s, right? There's so many tools available. Lasers, there's microneedling devices, there's all kinds of radio frequency devices, there's all kinds of stuff, but they're all limiting because you can only do one thing, right? So you got to understand, so you got to first say, what are the different things in the skin that are a problem? There's pigment problems, there's textural problems, there's pore problems, there's fine lines, there's deep lines, there's volume loss, there's a whole bunch of things. If you think about it, like if you make a nice recipe, you need a bunch of ingredients. You cannot just put meat and expect it to be good, right? You got to add a lot of spices and everything else. So medicine and plastic surgery is the same thing, because you need to target these very, very differently.